Good afternoon, ladies and gentlemen. It gives me great pleasure to present to this conference today on delivery room cuddles for extremely preterm babies and parents. So I'm going to start by defining what we mean by delivery room cuddle. It's also known as the birthday cuddle, and it's simply the chance for a mother to cuddle her preterm newborn before his or her neonatal unit admission and our facilitation of this. So we mean cuddling by the mother holding the baby in arms or on her chest, instead of just us showing the baby to them before the neonatal unit admission. So the delivery room cuddle may appear only a relatively trivial event to some professionals, but it's often a huge event in the life of a parent and preterm baby. It should follow the baby's initial stabilisation or resuscitation if needed, and the typical duration in our current practice is between 5 and 10 minutes. So we aim to practice this wherever and whenever possible and irrespective of birth gestation. So the talk this afternoon, I'm going to focus on the practice of offering the cuddle for extremely preterm infants, those less than 27 weeks gestation. And I'd like to start by showing a short animation by a parent of an extremely preterm baby who experienced the delivery room cuddle.
They say from the first time you hold your baby, you will never be the same. Your life changes. The love you feel and the emotion is overwhelming. When you have an extremely premature baby, you wish with all your heart that you could experience that flood of emotion the moment they're placed in your arms. You would give anything to hold them the way you have dreamt. Most mums of premature babies don't have the opportunity. They may have to wait weeks, months, or may never get to hold their baby while they're still alive. At 23 weeks pregnant, I was expecting twins. Charlie was shown to me and taken away to the neonatal unit as I was still in labour with his brother Jack. Jack had a more difficult birth and it took some time to intubate him. This was extremely distressing for us. Once Jack had been stabilised, the consultant asked me if I would like to hold him before they took him to the unit. I instinctively knew this wouldn't be something I'd get to do again anytime soon. Holding my baby in my arms was one of the most special moments in my life. He was so tiny, so perfect in every way, and never in my life have I been so proud and felt so much love. I was completely overwhelmed with emotion. Would any mother turn down the chance to hold their baby for the first time? Jack died from an infection after only 11 days of life. The only other time I got to hold my baby was as he died in my arms. I still find it difficult to speak about to this day, but the cuddle I had when he was born is something I will treasure forever. Jack's twin brother Charlie very nearly didn't survive. It's been a long journey to get him where he is today. He's a happy, healthy and crazy little boy with so much character. He's now 14 years old. Since the birth of my sons, I've been told that being able to hold your premature baby isn't something that every consultant offers. And to be honest, this surprises me. I needed to tell my story to raise awareness about just how much that first cuddle means as a mum. 14 years later, and this still isn't common practice.
So powerful words from Emma. So 14 years later and still not common practice, and yet we are in an enlightened era of family-centred care. We now know that optimal health outcomes are achieved when the baby's family members play a direct and active role in providing emotional, social and developmental support for their babies. This active role of parents in providing such support should start right from birth for all babies. And I think if we can enable the delivery room cuddle, it's an ideal way in which we can promote a partnership between parents and ourselves as healthcare professionals in the care of the preterm baby from the very outset. Allowing mums and dads the chance to cuddle their baby before the neonatal unit admission begins this partnership and can have many benefits. The practice is certainly feasible, can be done safely, and is beneficial. I believe it can and should be practiced for most babies born preterm for their benefit and the benefit of their parents. We already know the many benefits of kangaroo care and direct skin-to-skin contact. They're multifold and include physiological and behavioural benefits to the baby, such as better thermal stability, better sleep, better breastfeeding, earlier discharge home, and better growth and development. There are also psychological benefits to the parents, such as more positive feelings towards the baby, better bonding, less maternal stress, and more confidence in meeting the baby's needs. Now, while for extremely preterm babies, the delivery room cuddle does not usually involve direct and complete skin-to-skin contact because the baby's inevitably in a polythene bag and swaddled in blankets, some of the benefits may well be similar to those that we've seen with kangaroo mother care. We know and have known for decades that there's an early sensitive period in those first minutes and hours after birth, and they're really important for the formation of a tight bond between mother and infant. So this concept was introduced more than 40 years ago. It's a period characterized by a special neuroendocrine situation, probably mediated by oxytocin, probably also prolactin. And it's a unique period of increased maternal sensitivity and responsiveness. Facilitating contact directly in this period may improve the quality of mother and preterm baby interaction and increase the chance of long-term secure attachment. So why should we practice delivery room cuddle? Well, fundamentally, mothers and fathers want to cuddle their newborns. And that's irrespective of gestation. Cuddling the baby in arms after birth is instinctive for parents. Abrupt separation and removal to the neonatal unit of the baby who's already been with the mother for sometimes more than 6 months is traumatic, and that's probably mutually traumatic. A calm, supervised initial cuddle is a really marvellous opportunity for us to provide initial reassurance for parents, for them to meet and form an initial bond with their baby, and for the baby to feel a first loving embrace. Parents can then touch and kiss their baby and get first family photographs and videos. I believe there's a real imperative that we try and practice this, especially for the highest risk babies. Delivering cuddle is not yet common practice, unfortunately, and we already know that once a very premature baby is admitted to the neonatal unit, they're immediately effectively incarcerated in their incubators and shackled to multiple items of equipment. And invariably, if we don't allow that cuddle before the baby's neonatal unit admission, it's invariably many weeks before that first cuddle becomes possible, practically. The initial cuddle is especially important, I believe, for extremely preterm babies because they're the ones at the highest risk of dying. We can't always predict, in fact, we're very bad at predicting which ones are destined never to survive, never to make it home. So it's a real tragedy if the first cuddle is only offered to parents when their baby is dying or when they're called in suddenly and the baby is terminally ill. Some parents, out of sheer grief, simply cannot bring themselves to hold their baby in such circumstances, and they may live with grief for years thereafter, with guilt because of it. And so it's a real disaster for all if a baby dies suddenly, never cuddled. So why is it not yet routine practice? Well, something we've never done traditionally. We've always felt this immediate urge, it's what we've been taught and brought up to do, that we rush the babies to the neonatal unit because that's the place of safety where they've got to be. Well, actually, it's not that necessary to immediately rush most premature babies to the unit. I think it's not been adopted widely because until recently there's been almost absent literature, there's been very little published guidance, and there's not really been any safety or outcome data published until the last couple of years. There's been very few trials, even with less premature babies. There's been a singular lack of feedback elicited from parents, and we've not been very good at listening to what parents may need and want from the outset for their very preterm babies in the delivery room. However, I'm pleased to say it's now becoming more routine practice in more UK centres. What I've seen is unanimously supported by nurses and midwives. It's been my own personal practice for more than 20 years. What about the safety in extremely preterm babies? Well, in my own centre in Norwich, we've practiced it variably, but nevertheless consistently for more than 16 years now, and that's irrespective of birth gestation. So we reviewed short-term safety outcomes in the 12-year period between 2006 and 2017, and I undertook a case control study to compare short-term outcomes of inborn extremely preterm babies who'd received a maternal cuddle at birth and which had been documented. We compared those with a matched control group of inborn babies who'd only been shown to their parents before the neonatal unit admission. And the main findings of this case control study was that there was no difference in the time of neonatal unit admission or in the baby's admission temperatures if they'd received a delivery and cuddle, and there's no difference at all in mortality rates between the groups. So the conclusion was that offering parents a brief delivery and cuddle of their extremely preterm babies prior to the neonatal unit admission did not significantly delay the baby's admission time, nor did it make them cold before admission. So which babies should we be offering delivery and cuddle for? I think most babies, irrespective of birth gestation, should be considered eligible until proven otherwise. And this should include pre-viable babies. It should also include babies with anticipated severe congenital abnormalities and those whose postnatal survival may be uncertain. I think it's easier to consider which babies is it not indicated for, and that's relatively the minority. So obviously babies born when the mum's under general anaesthetic, it's not going to be possible for the mum to have a cuddle, but don't forget the father's in that situation. If the mother herself is acutely unwell after delivery or needing medical stabilisation, then it's inappropriate. If the baby's got an expected or an unexpected congenital airway malformation, then it won't be safe for the baby to routinely offer delivery and cuddle in that situation. Similarly, if a baby's needing prolonged ongoing resuscitation, such as needing urgent volume replacement or blood products or inotropic support, then we wouldn't want to delay the neonatal unit admission at all. I think more challenging, but where there's not an absolute contraindication, is where there's been a caesarean section done and the mum's awake. Certainly can be practiced, and we have practiced frequently in that situation. Similarly with twins and higher multiples, we've practiced, although it's more challenging. I think more debatable with babies who are born with congenital heart disease, expected or unexpected, and those who have been born with perinatal asphyxia who are requiring active cooling. They may or may not be considered appropriate to offer delivery and cuddle for. We have been able to offer delivery and cuddle for some babies with congenital surgical abnormalities on an ad hoc individual basis. I think when we're looking at the practicalities of offering the delivery and cuddle and how we carry it out, a fundamental aspect is that we have to have good communication amongst ourselves as a team, and that includes the midwives and obstetricians who may be in the room, ourselves between the neonatology team, but also fundamentally with parents as well, and that is key. So some of the things that we would say to the parents beforehand when we're briefing them is that we're going to be with you and will be with you throughout the delivery and cuddle. Your baby is stable enough now to receive a cuddle and is receiving optimum care from us. Your baby looks comfortable and is receiving all the medical support they're needing, and their care will be enhanced during the cuddle with you. Your baby will continue to be continuously monitored and will be safe during the cuddle. And if you want, we can help you take photos and videos of this precious family moment for you, if you like. So we've actually published quite recently, along with two parent experts and my co-author, Dr. Paul Clarke, we've published in Acta Paediatrica. It's an open access article, and I'll give the link at the end. We've shown the process for a safe delivery and cuddle, starting antenatally, covering birth and stabilisation, and almost a checklist really of what we can use to assess suitability of babies for the cuddle. It includes contraindications and also what to do and how to perform the cuddle itself. We've also shown a couple of ways it can be offered, and the commonest ways it is offered routinely, certainly for ventilator babies, is either using a transport incubator system with the baby connected to that, with getting all its ongoing monitoring with the monitors attached to the transport incubator. So that's often done, well, certainly in the maternity theatre of mum delivered by caesarean section. Probably the more common way, if it's been a vaginal delivery, is by us simply, when we're finished stabilising the baby, we'll wheel the resuscitator over with the baby on the resuscitator initially connected to the ventilator tubing, and then we'll lift the baby, still connected to the ventilator tubing, into the mother's arms. Really important is to get feedback on the practice of delivery and cuddle as to what parents think about the practice. So this is something we did as part of our retrospective survey. We carried out a questionnaire survey in June 2018 of mothers who we knew had received a delivery and cuddle of their babies in the delivery room over a 12-year period. So there are 22 mothers who had still living babies who were invited to feedback. And these are some of the questions we asked and responses we got. So one of the main questions we asked was, how important was that first cuddle to you as the mother of a very premature baby? And we asked them to rate on a Likert scale between not at all important and extremely important. And you can see that the vast majority of mothers felt it was extremely important to have that first cuddle as a mother. We also asked, how important do you consider it that doctors and nurses who work on neonatal units try and offer an initial delivery and cuddle as a routine before the baby's taken away to the neonatal unit? And again, we asked them to rate on the Likert scale, and these were all the responses. And the vast majority of mothers who responded said it was extremely important that we should try and offer it as a routine. We also asked parents what they felt the first cuddle meant to them. And these were some of the quotes we got from the parents who wrote free text responses. So one mother of a 26-week-old boy said, making that initial cuddle as close to as it could have been had he been born full term to make it feel normal was great. Another mum of a 26-week gestation baby said, it was incredibly important as I did not get to hold my son again for 2 weeks as he was too sick. That cuddle helped to initiate my breast milk and I was able to express and eventually breastfeed my baby when he was stronger. And a mother of a 22-week gestation boy said, considering how unclear the outcome of his birth was, I can honestly say that cuddling my baby boy was probably the most encouraging factor in deciding to express milk for him. And then Josie, mother of 23-week twin girls, said, I got cuddled with both. It was so beneficial to hear them cry and stop. To have that first cuddle was what we needed, as I wasn't going to have another cuddle for a while. And to have that first cuddle, I felt like a mummy. And I was very thankful because I didn't get another cuddle until I think 24 days later, which again was very emotional to see them and touch them. Maybe it was that first touch was what all we needed, knowing it was going to be a really tough journey ahead. I was and am so grateful to have had that first cuddle, and luckily I got that chance. I really hope this becomes the normal thing to have straight after delivering. It's such a powerful connection you have, even at that early on time. And I feel that's part of why the girls have done so well, because of as much skin to skin as I could do from the minute I could. So I've said already, I believe it's possible at any gestation. So any gestation, and even for pre-viable babies, but certainly the babies we're going to take away to the neonatal unit, and they're going to be there for days, weeks, many, many months, some of them. It's possible for even the most extreme preterm babies. And to illustrate that, with kind permission, I'm going to show you a little video clip taken in the delivery room of this 22-week and 6-day gestation baby in the first minutes after birth. So the timing of this clip, the baby's now 26 minutes postnatal when he's been handed into the mum's arms.
16.
Go put him back in.
He's absolutely fine if you want another couple of minutes. He's absolutely lovely. He's doing a bit too well, which is why I just asked Sam to turn him down a little bit.
So it's actually there, pull in a little. That's it.
Okay.
Just now, keep it on your
Okay.
Just really soft.
So what we got? We've got saturations 95.
Heart rate's 170.
Fantastic.
His temperature is perfect.
Super.
You've grown him very well, Mummy.
Thank you so much. Thank everybody. Thank
Very
you.
good job there. You would have been huge if you'd gone all the way.
So it's early days. So what we'll do when we get round, we need to put some special lines in
Okay.
into his tummy button, so we can give him some sugar solution and then some liquid feed as well.
Okay.
And then really important will be, are you planning to breastfeed? Have you thought about that?
Yeah.
That'll be really crucial. You
Okay.
can get work on, overnight, get some milk expressing, and then we can trickle that down into his tummy.
Okay.
We'll be doing an X-ray to check the position of the lines,
Okay.
and then just see how we go, minute to minute, hour to hour, and so far so good. We couldn't have hoped for a better state of him to start with. He's super. And good weight as well. We'll weigh him when we get round.
Yeah, do you know?
We don't know his weight yet.
Okay.
But as soon as we get round, we'll be able to weigh him, and then let you know what it is.
Daddy, did you want to stay with Mummy or did you want to come across with us?
I stay with
Yeah, let's go.
Yeah. You're going to be fine?
We'll be doing lines and bits, but you can all sit with him and
Okay.
we can keep you updated.
You talk to him.
You talk to him.
Telling you bad jokes.
See, Mum's not lost her sense of humour.
Oh my god, yeah, bad dad jokes.
It's just part of being a dad. Welcome to the... Join that club now. Bad dad
Finally,
jokes.
I have an excuse.
Dad dancing.
So I hope that gives you a sense of how relaxed and calm and peaceful and precious those moments are. So that's little Nicodeme, and he'll be 3 in July this year. So in conclusion, delivering cuddles are safe with appropriate preparation, supervision, attention to detail and teamwork. Good communication is key to success. We only have one birthday, one true birthday in our lives, and so we only have one chance to offer the birthday cuddle. The delivering cuddle is usually appreciated by parents, especially those who will sadly end up as bereaved parents. And it is feasible for the vast majority of preterm babies, irrespective of gestation. And really, it should be the norm and not the exception. So in closing, I'd like to quote Emma again. It started with her animation, but these are some words from her. She said, "A cuddle is so important. Being able to hold Jack right after birth meant the world to me, was so special. It's the hardest thing in the world, not having your baby near you after delivery, and you hold on to that one cuddle you've had. The cuddle I had with Jack when he was born meant so much, and all mums should have this opportunity." So I'd like to thank you for your kind attention. Here's the link to our paper. It's open access, or you can go to PubMed and type in Delivering Cuddle and it'll be the first hit there. It's freely downloadable and it goes through the practicalities in more detail, and it's got all the parental feedback that we received in our survey. So thank you very much, ladies and gentlemen. It's been a pleasure to present to you today, and I'm very happy to take any questions. Thank you.